So this is Renal Patient View 2. Number 1 was made by NHS Kidney Care. Now, what we know is there's an increasing number of patients are now motivated to go online. So actually people with long-term conditions, 63% are now regularly on the internet. And actually looking for health information has gone up massively. So over nearly 60% of patients will look up their health information online. Now, NHS Kidney Care developed Renal Patient View a number of years ago, and they did this by allowing all hospital data from renal units to go into one central database, and then from that it feeds into this website. Now, this has been picked up by The Guardian earlier this month, now has 19,000 users around the UK across 54 renal units. And actually patients, the key thing that they've found is access to their blood results. This has been particularly important. And as we know from the government's information strategy, this is something that we're all aiming to do both in primary and secondary care. These are some of the quotes about the current RPV system. So everyone wants to actually be able to access their results online. They feel this actually saves the time of healthcare workers because they're no longer having to just keep ringing them up to find out the latest results. And they are actually motivated to manage their own, say, potassium levels or hemoglobin, and they can actually take some of that into their own hands. So the big problem though, and we phoned up some renal physicians yesterday, was patients have to almost go on this constantly to check when they're expecting a blood test result to come up. So they're logging in multiple times during the day. And actually, one senior renal physician yesterday said he wanted patients again to be able to get the results, look at what's abnormal and phone them, so almost be proactive in actually taking their care into their own hands. So what we had been looking at previously was this. So this is the current version of Renal Patient View, and as you can see it has a very subtle login, which Kristian will log in hopefully now for us. And so when a patient logs into this, on Test HD, they're then able to go to the results section, which at the moment is actually quite bland and difficult to visualize. So you end up with just a list of all your results, and if you're expecting a new blood result, you have to go onto this constantly and then look through your list of results. So what we've actually done is taken the open source code for this, and not me, but these guys who can actually do this kind of stuff, have taken the whole database and the website, recreated it. Ayesha, who's a designer and actually has more imagination than I do, has started work on making it look prettier, making it easier to actually log into places, changing some of the icons. And actually if we go to the results section on here, we've started implementing some things to make it easier for patients. So particularly they'll be able to graph each blood test. So here we've got their potassium results graphed and their phosphate results graphed, so they'll know where it is over time. And actually beyond this, just on the last slide on the PowerPoint, we have also implemented a system just this afternoon where when a patient's new blood results actually get deposited into the database, it automatically generates an email to their email account. So now patients will constantly know as soon as their new blood results are in, they'll be able to link on and log into Patient Renal View. Now there's lots more now that we've got the code that can be done to this, including actually linking their blood results to ways that they can change this. So one idea is we've now got a database downloaded so they can look at how much potassium is in a banana or some spinach. They can then start to take active ways to change their own blood results. And there's plenty of other things that can be built onto this. So what we'll do now is pass this back to the Renal Patient View teams and allow them to continue to develop it.
Did you learn how we can make it so more bits of NHS software are open source and can be improved by people like you in the process?
Well, what was particularly interesting, and I suspect these two can say that, so what we've actually got here is they had already done the really hard part, which was actually getting the blood results from all these renal units going into one database. Once you've got that, we could tomorrow produce the colorectal patient view, the hematology patient view, all of this can now be replicated. The source code's all up there on GitHub now. So this can now be done for every patient, hopefully in secondary care.
I think it's a brilliant idea. I think patients need to take ownership of their own care and actually have their own information. One thing that I will say more of a comment as an intensivist is the worry that they become number focused rather than, so they look constantly for your potassium levels and then constantly feed back to clinicians with worries that they have. And there's always the variability of the blood results, especially over things like potassium. So it's just how you manage that.
Yes, one thing we wanted to put onto the graphs was particularly normal ranges, and also in the future you could have things like moving averages, so patients can be more used to what's normal for them as opposed to just looking at the numbers and seeing a slight up and down